Hello everyone, welcome back to our channel. Today we are going to discuss gestational diabetes, a condition where pregnant women have raised sugar levels in their blood. We are also going to dive into topics like how it can affect the baby and the mother and ways to manage it. So let's get to the video. Welcome to Bunnyhug YouTube channel. Here we discuss interesting topics on pregnancy and parenting to help you navigate the challenging yet wonderful journey of raising kids. About 2 to 10% of pregnant women are affected by gestational diabetes, which can have serious effects on both the mother and the baby. Let's understand why you may have gestational diabetes. Gestational diabetes mainly occurs due to hormonal changes during your pregnancy. When the placenta grows, the hormone secreted makes it harder for the mother's body to use insulin effectively. Insulin is responsible for maintaining the blood sugar level in our bodies. If the body cannot use it effectively, it leads to higher blood sugar levels. This phenomenon is called insulin resistance, which is the underlying cause for gestational diabetes. There are some critical factors that can make a woman more likely to get gestational diabetes. They are: number 1, age. Women who are above 25 years of age are more likely to develop gestational diabetes. Number 2, weight. Women who are overweight or obese have a higher risk of developing gestational diabetes. This is because excess weight can make it harder for the body to use insulin effectively. Number 3, family history. Women who have a family history of diabetes, particularly type 2 diabetes, are at higher risk of developing gestational diabetes. Number 4, previous history. Women who have had gestational diabetes in a previous pregnancy are more likely to develop it again in future pregnancies. Number 5, certain ethnicities. Women who are African American, Hispanic, Native American, or Asian are at higher risk of developing gestational diabetes. Number 6, polycystic ovary syndrome or PCOS. In simpler words, it is a condition that can cause hormonal imbalances and also cause insulin resistance in a woman's body. So, women with PCOS are at higher risk of developing gestational diabetes. It is important to understand that some women may develop gestational diabetes without having any of the above discussed factors, and some women with the discussed factors may not develop gestational diabetes. Also, the exact cause of gestational diabetes is still unknown, and it is believed that a combination of events can cause it. Now, let's see what are the major risk factors associated with gestational diabetes. Gestational diabetes can significantly affect both the mother and the baby. It can cause high blood pressure and preterm labor if not treated properly. It can also increase the chances of the mother developing type 2 diabetes in the later stages of her life. When it comes to the baby, they can suffer from macrosomia, a condition in which the baby grows overly large, making delivery harder and increasing the chances of injury during birth. It can also cause hypoglycemia in babies, which lowers their blood sugar levels. This can increase the baby's chances of developing type 2 diabetes later in life. Let's come to the most important question, whether gestational diabetes is permanent. Thankfully, gestational diabetes is typically a temporary condition that goes away after the baby is born. But women who have had gestational diabetes previously are more likely to get type 2 diabetes in the future than women who did not have it. It's not all bad news. The good news is that gestational diabetes can be managed with proper care and attention. Here are some ways to control or reduce the possibility of gestational diabetes. A good diet and exercise are the most effective methods to manage gestational diabetes. You can eat a healthy diet containing mostly whole grains, fruits and vegetables. Lean meats and healthy fats like nuts can help in stabilizing blood sugar levels. Limiting sugary and processed foods as well as caffeine is also helpful. Exercise can also help manage gestational diabetes by improving insulin sensitivity and reducing blood sugar levels. Another important aspect of managing gestational diabetes is monitoring blood sugar levels regularly. Your doctor would recommend you to check your blood sugar levels multiple times a day before meals and after meals to monitor how the exercise and diet are helping to regulate the blood sugar level. Sometimes diet and exercise may not be sufficient. In that situation, insulin injections are the last resort to keep the blood sugar level under control. Don't be worried about the insulin injections. They are one of the safest options for both the mother and the baby. Your doctor will work out a treatment plan for you based on your individual health and needs to ensure safe and healthy delivery. In conclusion, early detection and proper management can help reduce the risk of complications for both you and your baby. Remember that gestational diabetes is usually a temporary condition that goes away after your delivery. A healthy diet, exercise, followed by regular monitoring of blood sugar levels and listening to your doctor's recommendation closely can help ensure a healthy pregnancy and delivery. Thank you for watching the video. If you found this video helpful, like, share and subscribe to Bunnyhug India.